Good afternoon, everyone. I am so delighted to see you all here. Thank you for giving up some of your time this afternoon to join this discussion. We have decided that this format is going to be about 2 hours. And over that 2-hour period, our panelists will be discussing income, public assistance, housing, and homelessness. With the input from so many sources, we believe that we have successfully whittled down and combined a very long list of questions into 8 that really represent these particular topics. Each panelist will answer the first question, and they'll also answer the last 2 questions. In between, they've got specific questions that we've assigned for each of them to answer. With that, I'd like to introduce our panelists this afternoon. I think you're going to enjoy what you hear from them. Beginning with Deborah Hall, who's nearest to me. Deborah is from Montgomery County Jobs and Family Services. Next, we have Jim McCarthy. Jim is with Miami Valley Fair Housing. As we were preparing for panel discussions, we thought it was extremely important that we include the voice of the consumer. And to that end, we've invited Keith Beal to join us. Keith represents Beal's Janitorial Services. Next is Kathleen Shanahan. Kathleen is with Montgomery County Human Services Planning and Development Department. Tina Patterson, second from the end, is Homefull. And Jennifer Heapy, the Greater Dayton Premier Management.
She took my answer. No, and I'm scared she's going to tase me. They told me this is a taser, and I'm going to get it if I go over my time. So good afternoon. I'm Tina Patterson, and thank you. You know, it is hard not to bring the perspective of where you are or where you've been in the community. For over 20 years, I've been working with homeless. So it is difficult not to frame the discussion about all of these kind of questions without recognizing first and foremost that I always come from the perspective of what's the best interest of homeless people. So it's been an interesting time to get to this. So. You know, I too believe that one of the very first most important things are increasing affordable housing. We have strategies that we've been working on for about 10 years now, specifically with homeless, about increasing housing for people who are currently experiencing homelessness. And they've been very successful. We have some great outcomes that have recognized that we're reducing homelessness and housing stability for that population. The one piece we recognize is affordable housing. The problem is how do we define affordable housing? Because affordable is just a very generic term that many times we tend to use that, but what's affordable for me isn't necessarily affordable for other populations. So we have to recognize that affordable takes its different term. So first and foremost, I think we have to recognize that there are these different populations, whether they're geographically dispersed or whatever, that recognize that affordable is different for all kinds of people. And I think I was reading a study that basically said that in Dayton and Montgomery County, what is considered affordable housing is basically you have to earn about $47,000, $48,000 a year for a family of a single mom and 2 children. So that's a pretty remarkable thing. So again, and I think Kathleen had some certainly amazing ideas on how we do that. But the other piece that we tend to miss many times with the addition of affordable housing is there is a certain amount of service-enriched housing. Ideas that go along with different than the permanent supportive housing for people with disabilities, but in general, low-income people that need some kind of community services. I like that phrase, and you'll probably hear me use it a couple of different times, that it takes a community to raise a family. And I truly believe that. And I mean services taking into account not just the typical case management services, but how to enrich people's lives, whether that is understanding everything that is available to you in your community, linking you to those kinds of things in a way that is much more nurturing and less of a programmatic kind of approach. Back to that kind of mentality of it really is a community to raise that. So services such as community centers and linkage to activities and really some of those things that we typically don't think of when you think about services. The other, I think, big piece that I believe in as well, and that clock's ticking fast now, is I certainly believe that we have to look at economics as the other big key, increasing employment opportunities by being very creative, whether that's the creation of social enterprises and some different things that I'll probably get a chance to talk about a little further along. So I think two, to sum it up, one, affordable housing, and two, economic opportunities.
Thank you, Tina. Tina?
You know, I'm a Googler, so I Googled family instability, define family instability, just to see what would come up, and I was struck by kind of everything that it said. And one of the first things it said is the true cause of family instability is poverty. So, you know, it was an interesting kind of simple way of saying it, and I liken it to when I typically talk about homelessness. I usually say that you combined mental health and addiction disorders with poverty, you get homelessness. And so when I thought about it, I was like, if you combine a single mother, low income with 2 children with living in poverty, you get family instability. So first and foremost, I think the solutions began as we say a very simple way, which is to increase their economic opportunities. And not to oversimplify that, because I don't have the great picture of exactly how that would mean or what I would do to do that, but I think it starts with livable wages, you know, and making sure that people aren't paying 60 to 70% of what they are earning on their housing, which is combined again to the affordable housing. So I guess if you said how do we reduce family instability, we reduce poverty. The other thing is, I think I heard somebody already say is, you know, there are many barriers to getting yourself outside of poverty, and one is when you get a job and you're already on benefits, and what do you do with those 2 children that need child care assistance? You know, how do we remove or simplify the process that actually encourages a mom with 2 children to go back into the workforce versus it's very hard to take 2 children 2 separate places because there's 2 separate places that take the child care assistance. So we need to remove those barriers and simplify the process that lets the working mom work and have quality child care for the children as she is working. Whether that's a typical first shift, second shift, and to be honest, many people should work the second shift because they're different wages in second and third shifts, but less childcare available. So we see the conflict there. So I think that's one of the first things that I think. I also think the strengthening of the neighborhoods process, whether that's through better jobs, better housing, all of those kinds of things that Jennifer mentioned as well that make neighborhoods strong, are critical to the family instability. One of the other things I think is probably the key piece is real early interventions. And I don't mean just the clinical interventions of a child is presenting something at a hospital or in school. I'm saying we must all, as a collective community, start to recognize the signs and symbols earlier in recognizing that there's a problem. Social services traditionally have waited until they come to us for services. And usually at that point, they're in very much trauma and have lots of issues that take very much longer to overcome. So somehow we have to be able to recognize the earliest possible point of this family is facing a crisis. How do we get to them before the crisis is so much that it caused that kind of instability? So earlier interventions as a community, recognizing that it's not just the school's responsibility or a social worker's responsibility, that it's a community's responsibility to recognize those really early signs of what could be leading to family instability.
Thank you. Terrific responses. Thank you, Deborah. Tina?
Thanks. Well, I think a lot of progress is being made in kind of destigmatizing the whole welfare kind of mentality or process. I like to think about the word benefits, or making benefits available. I like to think about it more of the presentation of opportunities available to low-income folks, versus that still is, have you applied for your benefits? Well, have you looked at your opportunities? Just in that word itself changes the concept in which people begin to think about it. I love the idea and the mention of this collaboration process. Being in social services, a lot of times you forget all of the other touches that might have occurred of that one client that's right there presenting in front of you. And many times we still work in silos to where, I'm in the homeless, I'm going to think about homelessness and what is available to you versus looking at what all the other opportunities that exist crossing over into all of these other systems. So I think one of the best things that we could do is to look at some of this cross-training of availability of opportunities that can exist for consumers that are low income versus us saying, well, I can only do this and I'm going to send you here for whatever that could be. Is looking at how to blend that to make it a one-stop social, wherever I happen to land, whether that's in the homeless system, they can tell me what's available to me throughout all of the systems. So somehow being able to cross those silos and be able to share that kind of opportunities or information in a better, seamless way. I also tend to believe that you've heard me talk already a couple of times about this community integration and looking at communities. I've been around a while and I remember the old community centers, and I know they're a thing of the past, but there is still something to be said for going to the client versus having the client come to you. And I know that access through Benefit Bank and technology has certainly alleviated some of that, but there's still the process in which to even log in, get that kind of information, and it's a very black answer, yes, no, where the human touch, in particularly, is something so personal, would go a long way. Particularly when it's not so black and white, and I have a question, but how do I talk into that computer to get the answer back to me? So again, I go back to looking at ways in which we can integrate more of those services into communities or where they are at versus waiting for them to come to you. And again, when we wait, that's when things get worse. And we say we don't know how people know what's available to them. Again, I think that sharing of information through social services in general would go a long way at being able to make that kind of information accessible to the consumer that's right there in front of you versus, again, making you go to another organization. So again, I think the biggest piece to this is that we look at integrating where you're at, taking it 2 steps forward, which means backwards and catching you earlier and making all of us more generalist and less specialist and knowing I only work with homeless, I don't know these kinds of things. So certainly some cross-training would be beneficial, and I know I think that's probably one of the big key pieces we could do.
Thank you. We're going to come back to you.
Well, again, there's a theme coming from me. I also believe that it's critical that organizations cross over and share information in a way that is really in the best interest of the client. Is first and foremost one of the things that I think would be critical to making sure that whatever system you're in, you understand, that this client can be served in multiple systems, and recognizing how do we share that information, being very sensitive to the confidentiality of something like a behavioral health gap. But I think it's very, very important that we all work kind of outside of our purview to really prevent homelessness with a population that truly is probably one of the hardest to serve. And once we've been successful in housing placement with a subpopulation of people with behavioral health, you certainly want to maintain their housing. There is a model that exists right now. It's called the ACT model, which is the Assertive Community Treatment model, that I think many times is most synonymous with a severe and persistently mentally ill person, and not necessarily with a general mental health or a less severe diagnosis. That the concept is wrapping an entire team of professionals with very distinct disciplines, whether it's a psychiatrist or an RN, a case manager, and so forth. The model itself is what I like best, is really wrapping around a real collaborative, cohesive team that has its own disciplines and its own focus, whether that's an organization that says, I'm about housing or homelessness prevention, I can get services. I'm a community mental health worker, I can get you the mental health work that you need. I am your jobs and family services worker. And much different in terms of looking at what are the additional kinds of things that you can bring to the table versus just focusing on the behavioral health of that. Granted, I think that behavioral health person, part of that team, is a critical kind of model. So that it's not your client, my client, or somebody's, it's a team approach, and that team is just a little different than the traditional ACT model of a doctor, psychiatrist, or so forth, but it's service providers wrapping themselves around there and offering those very distinct disciplines to prevent that housing loss, and particularly to be there before they're in crisis, whether that's a mental health crisis or a housing crisis. And we all know that they're kind of synonymous, that at one point the mental health could then cause or lead to the homelessness issues and so forth. So how can this team, this collective team, that really is kind of outside of the normal, we typically look at mental health agencies doing their piece and homeless services agencies doing theirs. How could we blend those together to create this really unique team that's really focused on housing stability?
Thank you, Tina. Tina?
Well, being a homeless service provider, first and foremost, I eliminate all of her regulations. So,
Yes.
I mean, if I'm getting to do it, I'm going to do that first. So, but the reality is that we all have multiple funding streams that we have to be very sensitive to and mindful of. The recognition is that the problem is that people don't fit into those perfect regulations, nor does their disaster or their crisis fit into those perfect kind of regulations. So for us, I guess, if I can't remove everybody else's bureaucratic paperwork at Job and Family Services and GDPM, then I guess the thing that we would look for is this kind of flexibility that allows us to say, this is unique to this particular person, whatever that is, and I can assist you, which is outside of the norm of your regulations or of any other regulations. It allows you to really serve the person where they are at. We recognize that, and I'll use the example of people that come into the shelter. Many times we try to divert them from ever coming in, and that diversion we try to happen very quickly, which we all know that when you try to put somebody into a pot of accessing resources for them, nothing can go quickly. So we've created what we call as this very flexible pot, and really it is the opportunity to say that if I only had this amount of money with the no strings attached, I could truly impact that situation right now for that particular person. And so, since I can't remove all the regulations, I guess then I ask for the creation of this flexible spending that allows us to truly address that person in that situation at that particular point. I also do think that there has to be some kind of sensitivity to or mindness of the fact that when people are in need the opportunities presented to them or the benefits that are presented to them, there is a magnitude of bureaucratic paperwork and process that has to go through. If there was a way that we could streamline that to where if it's done once, it's done for multiple parties versus, well, I know you might have done this over here, but I need you to do it here. So I guess if I'm dreaming the dream, it's not necessarily removing that kind of regulation. It is somehow making it more efficient for the person that's in that crisis right then, that allows us to access those services and opportunities or benefits directly without that delay. Because, again, if we weren't able to prevent it 3 steps back, they're presenting now with that crisis and disaster, then let's try to make it as painless and as quick as possible.
Thank you. Thank you very much. Mm-hmm. Tina?
Well, back to my kind of original theme throughout most of my topics have been, this affordable housing concept with service-enriched, integrating and strengthening communities and looking at the earlier prevention kinds of things are kind of this critical piece to that. I'll echo some of Jim's comments, particularly on this, on his prevention for people that are facing evictions and so forth. In the homeless system, we've been very good about making sure that we're targeting resources to people who are at risk of literal homelessness, almost to the extent of not being able then to provide those resources to people who are facing eviction. That again, if we stay consistent to my theme of 2 or 3 steps before they show up in the homeless system, we have to recognize that eviction, while they might be able to say, yes, I'm not going to end up at the homeless shelter tomorrow, if not but for some assistance, then we say, okay, then you're not in need enough for us. But looking at trying to make sure that we recognize that those are folks that are probably 2 steps away from, that in maybe 2 years when we said no to that eviction assistance, that then now they've been living doubled and tripled up and are really truly showing up at doors of shelters. So I think a recognition of crossing over, and again, I think that's the other piece of my message, is that we need to go outside of what we traditionally have been doing. And I'm a homeless service provider and I'm going to do homeless services and I'm going to serve people who are at risk of becoming homeless or currently homeless, looking at how do we serve people. And really, how do we serve people who are in crisis? Whether that's crisis is generally for us is around a housing situation. So I think that the first thing I take away is collaboration and cross-training and looking outside of the silos that we're typically in. I also think that it's an opportunity for us, as we keep talking about economic empowerment and livable wages versus poverty and so forth, is we do have to start to talk about jobs and being creative about what that is. And going outside of what is the traditional kind of sense of you get that 9-to-5 job, whether that's the creation of unique opportunities like social enterprises or urban farming and some other opportunities that can serve both a couple of different, whether it's food desert areas and or jobs for folks. We have to recognize that there's great opportunities and very creative solutions to that. I also think that, I can't go back and say it enough that communities are the key to really strengthening families and decreasing family instability, is making communities stronger. How do we make communities stronger? We put jobs in their communities. We increase the quality of the housing that's there. You put food into neighborhoods that might not have food or access to food into that particular neighborhood. And then we get outside of waiting for people to come to us, and we go to you. We go to the person that is in need. And again, that's gonna have us all get outside of the box of the traditional way of wait until you come to see us. But I think that's going to be one of the critical pieces of making sure that the consumer's individual needs are being met where they're at.